And my name is Maria Coleus, and this is our mental health public service announcement.
So, defining mood disorders. Bipolar disorder is a mental health disorder characterized by extreme highs and lows in mood and energy. The highs are called mania, while the lows are called depression. And the other mood disorder is major depression. This is a mental health condition characterized by an inescapable and ongoing low mood accompanied by low self-esteem and loss of interest. Symptoms must be present every day for 2 weeks.
So, some of the personality disorders are antisocial, which is putting oneself in a dangerous or risky situations, often without considering the consequences for yourself or other people. Borderline is feeling worried about people abandoning you, and you would do anything to stop that from happening. Avoidant is avoiding work or social activities that mean you must be with others. Narcissistic, you have a grandiose self-image and think that you are more attractive, intelligent, and more talented than everyone else. And paranoid, you find it hard to confide in people, even people who are your friends.
Continuing defining personality disorders, schizoid is when a person is uninterested in forming close relationships with other people. Schizotypal is when a person finds making close relationships extremely difficult and behaves in ways that other people find eccentric. And then dependent is when a person feels needy, weak, and unable to make decisions or function properly without help or support. Histrionic is when a person actively is seeking attention and will manipulate people to draw attention to themselves. Then you have obsessive compulsive personality disorder, which is completely different from obsessive compulsive disorder, which is OCD. This is when the obsessive compulsive personality disorder is when a person has a need to keep everything in order and under control, and they set unrealistic standards for themselves and others.
So, schizophrenia is something that is a completely different category, and it is characterized by thoughts and experiences that seem out of touch with reality, disorganized speech or behavior, and decreased participation in daily activities.
So, to talk about treatment, bipolar disorder, how to treat it is a person would take lithium carbonate or other medications such as Latuda, which stabilize the mood. And for major depressive disorder, a person would take SSRIs, which blocks the serotonin reuptake. However, there is an increased risk of suicide due to increase of motivation. For personality disorders, recommended treatment is years of therapy to help cope with symptoms, and sometimes medication is needed, but the patient may refuse to take it. And for schizophrenia, antipsychotic medication that increases dopamine in the brain will help treat schizophrenia. However, the increase in dopamine can cause Parkinson's disease.
So, some statistics for mental health are that 1 in 4 people are affected by a mental health problem in any year. And if you didn't realize that, that's 25%. That's quite a lot. 10% of children and young people aged 5 to 16 have a clinically diagnosable mental health problem. Yet 70% of children and adolescents who experience mental health problems have not yet had appropriate interventions at a sufficiently early age. And mental health by the numbers, 1.1%, which is about 2.6 million American adults, live with schizophrenia. And another one, just to list them off, is 2.6% of people are affected by bipolar disorder, and that's from American adults per year. So the whole reason we did this public service announcement was to help to erase the stigma surrounding mental health. So unfortunately, people tend to have a negative attitude and belief towards mental illness. Stigma can lead to discrimination, and discrimination may be obvious and direct, such as someone making a negative remark about your mental illness or your treatment. But the stigmatization of mental illness can cause bullying and other forms of harm to occur. We can spread awareness and understanding of mental illness by just talking about it, and thus we can eliminate the discrimination and find ways to accept and combat mental illness.
That is our presentation. Thank you for listening.